am Dr. Lisa Flowers, full professor in the Department of OBGYN in the Division of Gynecologic Specialties. I joined the department in 1999, and my major role there was to actually develop some standard of care for cervical cancer screening in women at Grady Memorial Hospital. We realized at that point we really did not have a good system in place to assure follow-up of women, and that women really were presenting with cancers because they weren't being detected early. We're treating everything inside the vagina. We're treating the cervix, we're treating the vulva, and we're even treating around the anus. But these women are recurring with disease. And what I realized was we're not going inside the anus to see if there's still disease present. And that's why I decided to get trained in high-resolution anoscopy and to make sure that I, as a physician, could provide the total package of care that these women needed. What I really want to do is make a difference in the field of HPV-related disease. And I feel that developing this lower genital anal dysplasia treatment fellowship is going to really open up a field for gynecologists to be able to really, truly find the answers by which we can reduce HPV-related diseases in our population, which are mainly women. And what I was very proud of is being the first to really try to develop this fellowship, to understand that gynecologists can be experts in this area because we already do it. We're just applying our skills into another area of the body. So the fellow will be able to, first of all, learn how do you screen in low-resource countries. She'll also be able to have all the tools that she would need to actually do research, whether it's bench research or whether it's clinical translational research for the multiple trials that I run in my clinic, to be able to understand what are the biomarkers, what are the risk factors, the social determinants that put women at risk for cervical disease or anal cancer. She will also be able to learn how to do high-resolution anoscopy and complex treatments of extensive vulvar dysplasia, vaginal dysplasia that typically you may not be able to be exposed to in a regular GYN residency. When I first brought up the idea that, come on, come into this room, do this anoscopy with me, they're like, Dr. Flowers, I don't see that this is going to be something I'm going to do in the future. Now they're like, Dr. Flowers, are you doing an anoscopy? I want to come in, because they realize that we have been able to have an impact on cervical, and that they realize they that this is a new area that they can definitely build a career on. And so now I'm just having residents beat on the door because they really want to work in this area and understand that it's so important to have it as part of their toolkit of how to manage care in the future, especially for women.